Welcome back guys. Now in this video, let's discuss about nerve fiber classification. Okay, nerve fiber classification. See, actually the topic is very simple but most of the students find it difficult. Actually whatever the fibers were there, whatever the neurons were there, they are actually classified into two different types. For example, imagine I am there and my friend is there. For example, there are different types of neurons. I am going to call these neurons A, B, C. For example, there is this type of nerve fiber. I am going to call it as A fiber, B fiber and C fiber. And my fellow scientist is going to call it as, he doesn't like ABC terminology, he is going to call it as 1, 2, 3. But it is the same, the nerve fibers are going to be same. So according to one classification, they are going to be called as ABC, A fiber, B fiber and C fiber. And according to the other classification, numerical classification, they are going to be named as 1, 2 and 3 fibers, something like that. Okay. Question is, so the nerve fibers are classified into different types. Okay, there are two types of classification. Based on what? Based on what the nerve fibers are classified? So, based on myelination. Okay, based on myelination, nerve fibers are classified into two different types. See, let me show you the table. See, the classification of nerve fibers. As I have already said you, there are two types of classification. One is called as Erlanger-Gasser classification and numerical classification. According to numerical classification, see, there are one type of fibers, 2, 3 and 4 fibers. And the same fibers, according to Erlanger classification, they are called as A, B, C fibers. Now, what is the difference between A, B and C fibers? It is the myelination. Okay, it's the myelination that is different. When you are moving from A fiber to C fiber, what's that getting changed? Which parameters are going to change, sir? When you are moving from A to C, look, A to C, myelination decreases. Okay, myelination decreases. Which means A fibers are highly myelinated fibers, C fibers are unmyelinated fibers. C are unmyelinated. Okay, unmyelinated. What else changes? Sir, when you are moving from A to C, the diameter decreases. Which means A fibers are going to have a bigger diameter, they are going to have a bigger diameter. C fibers are going to have a smaller diameter. Okay, so diameter decreases. The diameter of the axons decreases. See, diameter is directly proportional to the velocity. More the diameter, with high speed, the action potentials of the electrical impulses will be conducted. Less the diameter, slower speed of conduction. So now tell me, the electrical impulses are going to be conducted with a high velocity. In which fibers? A fibers. So A fibers have high velocity, C fibers have least velocity of impulse conduction. So velocity decreases. So these three are the important points which I wanted to know. When you are moving from A fiber to C fiber, A to C fiber, what and all are going to be decreased? Diameter decreases, velocity decreases and myelination decreases. Okay. So here also I have written, as you are moving from A to C, okay, as you are moving from A to C, diameter and velocity decreases. Okay. Now, let us go one by one. The main important classification which I want you to know for your exams are the Erlanger-Gasser classification. Say A fiber. A fibers are further divided into A alpha, beta, gamma, delta. A was further divided into A alpha, beta, gamma, delta. Some of them are sensory, some of them are motor, some of them are both acting as sensory as well as motor. Okay. See, A alpha fibers, A alpha. Have you ever heard about alpha motor neurons? Okay, have you ever heard about alpha motor neurons? Somatic motor, alpha motor neurons which are involved in the muscle contraction. So, alpha motor neurons, that motor neurons which are involved in the contraction of the muscles, they are belonging to which fibers? A alpha type. They are A alpha fibers which are highly myelinated. Okay. And A alpha fibers are also doing one more job, A alpha fibers. That is proprioception. Proprioception means taking the proprioception means sensory. See, A alpha fibers are both sensory as well as motor. They are both sensory as well as motor. Which motor fibers? Alpha motor neurons are A alpha fibers. Okay, motor neurons which are causing the muscle contraction, they are A alpha type of fibers. And from the muscles, information about the muscle length, and information about the tension inside the tendons, are also brought by, they are being conducted to the central nervous system. This information is going to the central nervous system by the same A alpha type of fibers. They are sensory. Okay, so these are the sensory fibers. See, from the muscle spindle, about the length of the muscle, from the muscle spindle, and from the Golgi tendon organs, from the tendon, what is the tension inside the tendons? Okay, more tension or less tension. So this information from the muscle is going to the central nervous system with the help of same A alpha fibers. But according to numerical classification, that neuron which is taking the proprioceptive information from the muscle spindle, it's A alpha only, but according to numerical classification, it is called as group 1A fiber, and that neuron which is taking the proprioceptive information from the Golgi tendon organ is grouped as group 1B fiber. So group 1A fibers and group 1B fibers, they are nothing but the alpha motor, they are nothing but the alpha A alpha fibers. They are nothing but the A alpha fibers. So if someone asks you, A alpha fibers, they are sensory or motor? They are both sensory as well as motor, sir. What is the motor function? Muscle contraction, they are somatic motor neurons. A alpha fibers are also sensory. They are taking which information? Proprioceptive information from the muscle spindles as well as Golgi tendon organs. A alpha fibers are Erlanger-Gasser classification. Group 1A, 1B fibers are numerical classification. Group 1A, 1B fibers are sensory, proprioceptive. Next, A beta fibers. So what are these A beta fibers? They are sensory. A beta fibers are sensory. From the skin, we are having touch receptors, right? We are having touch receptors. When you come and touch here, the touch receptors are going to be activated. Now the touch receptors are going to activate the first order neurons. They have to activate the first order neurons. So these first order neurons which are taking the touch information are the A beta fibers. So A beta fibers carry touch information. So those neurons which are carrying the touch information are the A beta fibers. Okay, they are also carrying pressure information, touch as well as pressure. Next, gamma neurons. Have you ever heard about gamma motor neurons? There are two types of motor neurons. Alpha motor neurons for the muscle contraction, and gamma motor neurons causes the contraction of the muscle spindle. With the contraction of the muscle spindle also have to contract. According to the muscle length, the muscle spindle also have to adjust to maintain the proper tone. Okay, so gamma motor neurons, they are motor to muscle spindles. They cause the contraction of the muscle spindles. Next, delta, A delta fibers. You just take a pin and try to prick. So you are going to have a sharp pain, right? Sharp pain, very fast pain, acute pain, epikratic pain. So such fast pain is going to be carried by A delta fibers. Fast pain. Not only fast pain, cold. Okay, cold sensation MCQ. So cold sensations are going to activate those thermoreceptors, and the thermoreceptors are attached with the A delta fiber. So fast pain and cold sensations are carried by the A delta type of fiber. Also it carries touch. So A beta carries touch as well as A delta also carries the touch. Next, B fibers. What are B fibers? B fibers are myelinated or unmyelinated? Yes, they are myelinated but less myelinated. Okay, they are less myelinated. Now what are A beta fibers? Now if you look, this is the spinal cord. Okay, this is the spinal cord. From the thoracolumbar region, the sympathetic neurons are going to come out. These sympathetic neurons, they will go into the ganglia. Okay, they will go into sympathetic ganglia. Now from the sympathetic ganglia, the postganglionic neurons are going to come out. These are the postganglionic neurons. These are the preganglionic, these are the postganglionic. So these preganglionic sympathetic neurons, these preganglionic sympathetic fibers are they are B type of fibers. Okay, they are B type of fibers. Preganglionic sympathetic are B type of fibers, which means they are less myelinated. Okay, they are less myelinated. Next, what about the C type of fibers? C type of fibers are unmyelinated. They are unmyelinated. Where do you see? C type of fibers are example these. Okay, these fibers. This is the postganglionic sympathetic. Postganglionic sympathetic fibers are C type of fibers, and in our body most of the neurons. Okay, most of the neurons are C type of fibers. Okay, most of the neurons are the C type of fibers. They are having no myelination, unmyelinated. And these C type of fibers, they are going to carry what other sensations? What other sensations is pain. Now you will get a doubt. Sir, pain is carried by A delta fibers, but it is fast pain. Now C type of fibers are going to carry slow pain. Okay, slow pain is carried by C type of fibers. And the C type of fibers also carry heart sensation. Okay, heart sensation and slow pain is carried by C type of fibers. Okay, so these are some important points which I want you to know. It's the same ABC fibers. According to Erlanger-Gasser, they are ABC. According to numerical classification, they are 1, 2, 3 and 4. 1A and 1B are carrying proprioceptive information from muscle spindle as well as Golgi tendon organs. Then what is 2? 2 is nothing but A beta. According to Erlanger, it is A beta. According to numerical, it is 2 type of fiber. Then what is 3? A delta fibers. A delta fibers are group 3 type of fibers, and C fibers are group 4 type of fibers. 1 consists of 1A and 1B, 2, 3 and 4. Okay. So, this is the classification system. Now, let us discuss about something important for your exams, and it is related with anesthesia. So, if you use local anesthetics, okay, if you use local anesthetics, we know the nerves are going to be inhibited, right? The nerve impulse transmission or the electrical impulse transmission is going to be inhibited. So, when you use local anesthetics, which fibers are going to be inhibited first? A gamma fibers followed by B followed by C. So, A gamma fibers are going to be inhibited first with local anesthetics. When you apply pressure, which fibers are going to be damaged first? With pressure, A alpha fibers followed by B followed by C. C fibers are least damaged. Next, with hypoxia, which fibers are going to be damaged, or which fibers are highly sensitive to hypoxia? It's a B fibers followed by A followed by C. How I should remember is, whenever there is hypoxia, okay, hypoxia, do you welcome hypoxia? No, hypoxia is not good. It's not like we don't want to welcome hypoxia. We are going to say go back. So something like that. B, A, C. So everywhere C fibers are least damaged. C, least damaged. So local anesthetics knockout, A gamma first, pressure is going to damage A alpha, hypoxia is going to damage B followed by A followed by C. So these are some important points which I want you to know regarding nerve fiber classification. Hope the video is helpful. Thank you.